Hi guys, welcome back to Codemaster Coach, your medical coding tutor. I've been asked to start back studying CPT with you. So that's what I plan to do in this video. This video we're going to be talking about CPT. Those of you that are following me with ICD-10 CM, stay with me. I will continue to upload a video on I-10 every week. But I want to, for those of you that are questioning me about CPT, I want to get a video in on CPT. I've already done we're starting in E&M because that's the first section in CPT, Evaluation and Management. I've already covered physician outpatient services, and the next area is observation. I have a series on my channel already on E&M 1, which talks about me baking a cheesecake, which was the way that I put it together so that I'm hoping I could build it and make sense for you as far as evaluation and management and different levels of history, exam, and medical decision making. So that's what E&M covers. But E&M goes into the different healthcare settings. And it starts with your physician office, and it describes the difference between a new and established patient. But the next area is observation. And if you don't really know what observation status is, I uploaded a video on my other channel, Medical Coder Life, all one word, and I shared with you exactly what observation status is. And I found a brilliant video that I included in my video to further explain observation, because a lot is going on when it comes to Medicare and discussing observation status. So when you get a chance, please go to that channel, Medical Coder Life, and view that video on observation status so you can hear what's going on these days with it. But now in this video, I want to share with you how to code observation status. First things first, I want to show you the book, because somebody's going to say, oh, I can't find these codes in I-10. Again, this is not I-10 that I'm covering right now. This is not ICD-10, this is CPT. So I'm going to show you what the book looks like, and I'm going to show you the area that we're going to be in. Okay? First, this is the book, CPT. I have the professional edition. You should have the 2019 edition if you're staying current. This is my 2018. I got to find my 2019 edition. But at least the codes in here are the same. And the first section in CPT is Evaluation and Management, which are your E&M codes. I've already talked about office and other outpatient services and the difference when, how to know when to use the new patient code versus the established patient code. Okay? But that leads us right into the next setting after the physician outpatient setting. It's observation services. So at your earliest, please go through this section in your CPT book and understand what observation services is. Read over it. Look at the codes. Notice that the codes for observation start with 99217 and they go through 99220 or 99217 through 99220. Those are your initial. And then 99224 for your subsequent observation care. Remember, subsequent means next day. And then you also have another section. Go through all of these, 99224 through 226, 225, 226. And then go over to 99234. 35 and 36. Okay? So guys, make sure first, as you're studying this, go back through each one of these codes. Look at 99217 and read the definition of that code. And do all the way through 99217 through 220, and then 224 through 99226. And then read 99234 through 99236. I found that if I can read over the code, it tends to sink in with you a little better. Okay? So let's talk a little more about observation status. Now, as I said, observation status is It's like the next level after ER. You've come into the ER, the physician has rendered your services, he's a little nervous about sending you home, so he puts you on what's called observation services. He's just going to observe you for a little while. You're not admitted. Observation service is not admission. It's still considered outpatient services. So even if he doesn't physically move you because a bed is not available right now, once that order for observation status is written, you're on observation status. Therefore, your coding is observation. And if you go from emergency room to observation in the same day with the same physician, that physician should render the highest level E&M code, which in this case moves from ER to observation. So if the same physician admits you to observation, instead of rendering the ER code, he's going to render an observation code for his services for you that day. All right, let's look at an example. Suppose a patient came into the ER at 11 p.m. on January 1st, complaining of chest pain. After all the tests were done, and it shows nothing, as far as a heart attack, but there's a family history of cardiac problems such as a heart attack or anything, and so your physician decides to put you on observation status, and he admits you. The patient agrees to stay, and he continues to monitor the patient for the next 3 hours. Finding that the patient seems safe, the doctor agrees to discharge the patient home the next morning at 3 a.m. on January 2nd. The way this would be coded is to use the code to describe the hospital observation code done per day. So that looking at code 99218 through 220, you'd use one of those codes for the first day, and then you'd use the 99217 for the second day, January 2nd, when the patient is discharged. So look back over those codes. The initial day would come in at 99218 through 220 based on the level of history, exam, and medical decision making. And then because the patient was discharged the next day, you'd use the 99217 code for the discharge. All right, let's look at the second set of observation codes, 99234 through 236. These codes take into account if a patient is admitted and discharged on the same day. Now, because the admission and discharge occur on the same day of service, both are included in one number, and there is no need to do an initial E&M code and a discharge E&M code. You just do the one E&M code because your physician can only generate one E&M code per day. So let's look at an example of how you would use these codes. What if a patient came in, let's say that same patient that came in on January 1st at 11 p.m. and was discharged January 2nd at 3 a.m. Let's say that the patient came in at 9 a.m. on January 1st and was discharged at 12 noon on January 1st. Since the admission to observation occurred on the same date as the discharge, the one code would be used for that one day would be between the codes of 99234 and 236 series based on the history, exam, and level of medical decision making. You just generate one code, but it would be in that 234 through 236 that states patient was admitted and discharged on the same day. All right. So remember that the insurance company that's going to be reviewing your observation claim is going to look at the date on which the service occurred. So that date is very important. This is most likely the reason behind having two separate code sets for observation care. You've got to distinguish between the two. So remember that although these observation codes describe E&M services, they should not be used to describe services rendered to patients following surgery. For example, the recovery room, the pre-op, the post-op, any portion of that surgery is not considered an E&M. E&M codes do not describe procedures. that may happen during an observation care. Medicare requires that in order for a physician to bill for observation type services, you must have a dated and timed physician order regarding the care that the patient is to receive while they're on observation, nursing notes, progress notes prepared by the physician while the patient's in observation, and any record that was prepared as a result of the patient being admitted through the ER. So that ER record, that would be a part of the observation record. So again, the date and time that the physician made the order is on that chart. Now, some hospitals don't have an official observation floor or unit to send the patient to. These facilities, these patients can be observed in the emergency room or any other area that's designated as an observation area for that facility. The important thing is not necessarily where the care is rendered, but that the patient is receiving observation services. So again, the order is the key. There are several questions that you may have concerning hospital observation service codes. The first is, what code is used if a patient is seen for a second day in the observation unit and they're not admitted to the hospital? You will notice that CPT only addresses the initial observation care and not any subsequent visits. Remember, the purpose of observation is to see what's going on with your patient. Therefore, it's the likelihood that a diagnosis should be confirmed within 24 hours. So observation is a 24-hour period. As for Medicare with regard to billing for observation care, they state that the norm is to expect that patients will be discharged within 24 hours after the initial admission time. Now, sometimes patients will stay a little longer. So in that rare instance in which a patient is not admitted to the hospital setting but continues in the observation unit until the second day, the physician would bill for the initial observation care for the first day and then the observation discharge for the second day. Because a lot of times they will go, either they'll be discharged or the patient will be admitted to hospital. So they'll come off observation and be discharged or else admitted. Second question you might have might be in regard to what to do when a physician sees a patient in the observation unit but is not the admitting physician. So CPT suggests that the non-admitting physician should use office or other outpatient services code, whether it's a consultation or whatever. An example of that is if a patient was seeing an ophthalmologist for a condition they were having with their eye and they needed to have services the next day and they're on observation in the hospital. If that ophthalmologist comes into the hospital to see the patient to render services that he was doing anyway on an outpatient basis, when he comes into the hospital, where he comes doesn't matter. He's still rendering outpatient services to the eye. So that second physician would render an outpatient code, E&M code for his services, and then your E&M admitting physician for observation would do their E&M code. There are three additional situations that can be confusing in coding for hospital observations. When someone's admitted to the observation unit and discharged that same day, use only codes 99234 through 99236. Okay? You'd only have one E&M code. When the patient's admitted to observation unit and then not discharged until the next day, you'd use the 99218 through 220 for the first day, and then the 99217 for the second date when they're discharged. Okay, so if they're admitted and discharged on the same day, you're in the 99234 through 99236. But if they're admitted on one day and discharged on another, in observation, you'd use the 99218 through 220, 99220 codes for the first day, and then 99217 for the second day or the date their admission, they're discharged the next day. And when a patient's admitted to the observation unit and then on the second day admitted to the hospital, in this case, you'd code for the hospital observation on the first day and then the hospital admission on the second day because they're admitted. You'd go with the highest level of E&M. All right, let's say that a patient is seen in had a car accident. They're brought into the emergency room by ambulance. ER physician examines the patient, finds that the vitals are good. Patient has no broken bones, but the patient's unconscious. And the ER doctor decides to admit the patient to observation until the patient comes to. In other words, gains their consciousness. When the patient finally comes to on the next day, you would bill services using the hospital observation codes for the first day since the physician provided the ER services and the admission to the observation unit. That observation discharge code 99217 would be used on the next day. So again, came to the ER and was admitted to observation. So that one physician that saw the patient the first day in the ER, admitted him to observation, would use that 99218 through 99220 code for the first day. And then when the patient's discharged the next day, they'd use 99217 for discharge. Suppose you're a diabetic patient and you're currently being treated by a physician in internal medicine. Over the weekend, you experience severe dizziness and you go to the emergency room where the emergency room physician does a preliminary workup and is unable to locate any specific reason for your dizziness. And he decides to admit you to observation status. Well, since you've been working with your doctor for years and you asked the ER doctor to contact your doctor that you've been seeing for your diabetes and let him know that you're in the emergency room, and he does so, and then your doctor that you've been seeing for years for your diabetes decides to admit you. Once your ER physician turns you over to your physician that's been treating you, that's going to admit you to observation, then that ER doctor will submit an E&M code for his ER visit, and then your doctor would submit an observation admission code for his initial day of seeing you in observation. So in that case, 2 E&M codes can be generated because they're generated by 2 different physicians in 2 different settings. So again, your internal medicine physician that was treating you for diabetes, when you went to the ER and you saw the ER doctor and you told him to contact your physician and your physician decides to admit you that same day, 2 E&M codes can be rendered. One for the ER doctor for his services and one for your attending physician that admits you to observation. Okay? Finally, let's say that you go to your physician complaining of a severe headache. Your doctor takes a history consistent with your complaints, examines you and prescribes some special migraine medication. Well, since it's almost 5 p.m. and you have no one to take care of you when you get home, your doctor decides to admit you to observation. Because you have no insurance and you never had a headache of this kind, you agree to stay. After about 45 minutes of being in observation, you feel better than you have in years. So your physician discharges you and sends you home. So coding for this example would simply be the coding from the observation and inpatient care services 99234 to 99236, which includes the observation and care and the discharge from observation. You would not code for the office visit because the office visit grew into a larger, more global service. So again, you went from your physician's office who then decided to admit you, and when he admitted you admit you to observation services, and within 45 minutes you feel better, then your physician's not gonna bill for the office visit because it grew to observation, but because you went home that same day, then your range of codes would be between that 99234 to 99236. Okay, guys, I hope I've explained observation coding to you. and it makes sense. But again, the key is you have got to study your CPT book, read over these codes, and get a better understanding. They kind of clearly state to you what they are, but you just got to understand how to use them. All right, thanks guys. I'll see you in the next one.